Hello. I thought it might be useful to talk a little bit about foreskin problems, in particular circumcision. I get a lot of men who come to see me from oddly all over the world who've got tight foreskins or diseased foreskins, and I think that's because I've published a little bit on techniques to avoid circumcision and also the pros and cons of circumcision in children. Although about 30% of little boys in the world are circumcised for either religious reasons or for reasons we don't really understand, for example, in North America, only about 3% of men, we think, develop a foreskin problem which needs treatment. The tendency for anybody with a foreskin problem is to do a circumcision. Now, that's certainly not necessary in the majority of little boys. Most boys who've got a tight foreskin before the age of puberty will respond very well if they just have some steroid cream put on it. And certainly they shouldn't have any attempts at forced retraction. If by the age of about 9, you've tried the steroids and your son's foreskin is still tight, then speak to a good pediatric urologist. After puberty, it's a different matter. Most adults with a tight foreskin will not respond only to steroids. And particularly if there's any scarring of the foreskin, the only option may be a circumcision. Now, for some men, I'll have a video separately on this, there are minimally invasive operations such as preputioplasty for circumferentially tight foreskin or frenuloplasty for scarring or tightness of little bowstring underneath the foreskin. And these are very, very effective, more so for the frenuloplasty than the preputioplasty, but still very good options which will usually allow a man to keep his foreskin. Where there is scarring, the commonest scarring condition is one called LSA, lichen sclerosis epitrophicus. It's also called BXO. Where there is scarring, it's usually impossible to preserve the foreskin. We don't know why this is. The foreskin seems to scar, loses elasticity, scars again, gets tighter and tighter, a vicious circle, if you like. And where we have this chronic inflammatory scarring, circumcision is nearly always the best way forward, although I do work with some experts in dermatology who can save some foreskins, although there's a lot of involvement, a lot of treatment for the man with that. However, if there is scarring, circumcision is the best way forward, and it's not the urban myth horror story which lots of men seem to think it is. Most of my patients have this done under local anesthetic as an outpatient. They tend to take painkillers for 1 or 2 days at most, sometimes a little bit longer at night time because men get painful erections at night. And the majority of men say it's not nearly as bad as they were expecting. Men who have a tight scarred foreskin will have a little bit less sensitivity after circumcision than if they'd never had a problem beforehand, but they'll usually be much better off than when you had the foreskin problem. 30% of men are circumcised for no medical reason as children, and the great majority of them go on and circumcise their own sons. So while I don't think circumcision should be done without a medical reason, by and large, I can see that most men who've had it done are pretty happy with it. Some are not, and some have disasters, but that's pretty rare. Now, if a man has a worry about sensitivity, there's a lot of stuff out there on the internet. And what I will say is that a man who has a normal foreskin should keep it unless he wants to change religion or something like that. And a man who has a diseased foreskin, if it can be made normal, then good. And if not, he's better off without it. Better off in terms of hygiene, better off in terms of mobility of the penis, and usually much better off in terms of sensitivity. Now, what about a man who just has a tight foreskin in adulthood, who doesn't have lichen sclerosis? Well, I've tried lots and lots of stretching in the past. I've always gone away from the old stretching devices because lots of my patients rip the foreskin. There's no control with those. And I have tended to use a steroid cream with stretching, which initially just involves putting little fingers in and stretching like that. And of course, if the foreskin is so tight, you can't get your fingers in, that's not possible. Probably about 50% of men without scarring who stretch the foreskin will get away with that without needing circumcision. Some men will get to a point where they can have a preputioplasty, widening of the foreskin, instead of a circumcision. But we don't have really good follow-up on that because we haven't been able to do any formal trials of it, and a lot of men don't come back for follow-up. So this is my personal opinion, maybe a 50-50 chance rather than any published data. Now, there is a new gadget on the market, and it's come from Australia, actually from one of my friends who's a professor of urology in Australia. It's called the Novogland. This is what it looks like. It relies on the principles of tissue expansion. And what you do is you put this under the foreskin and then pump it up, and it forms a little balloon. Put it off, the little valve off, and then we turn this, and this stays under the foreskin for a few hours. What tissue expansion does in other areas of medicine and plastic surgery is to encourage new skin to grow, and that's the concept here. So it doesn't rely on steroids. In fact, we shouldn't use steroids with it. It takes, of course, a number of months to have its effect, but in the original trials, which need to be replicated, about 85 to 90% of men can avoid circumcision. Good. For those men who do need circumcision, however, we do it under local anesthetic for the vast majority of patients. Patients go home the same day, and the great majority, 6 months down the line, have much better sensitivity and are very happy with it long term. Complication rate in my hands is only 1.5%. Indeed, we offer an option where we do everything, including revision surgery, because the risk is very small, and we have a lot of satisfied patients. So to summarize again, if your foreskin is normal, unless you're doing it for social or religious reasons, you're better off with the foreskin. And if your foreskin is abnormal and we can't fix it, you are actually better off with the circumcision, and it's not nearly as bad as most men think. Thanks.